We're here today with Wendy Weidner from Alzheimer's Disease International. Wendy, could you tell me a little bit about what you do?
Yes, I am the Research and Policy Project Lead at ADI. I work with our Medical and Scientific Advisory Panel at ADI, and I lead on all of our research that's done within the organization. We really are looking into keeping dementia as a health priority globally. But we're also about reducing stigma and raising awareness of dementia and facilitating research to make sure that we look at both not only getting a cure for dementia in the future, but we're looking at people that are dealing with dementia right now. So it's about how can we better care for people who are living with the condition now.
And so can you tell me a little bit about how that ties in with the theme of the conference?
It's been a really interesting conference, actually. And we've come from the perspective of looking at how it impacts on women who are providing a lot of the informal care for people that are living with dementia, and how dementia affects them disproportionately to men, number one, but also that they are caring for, they provide 71% of the care for people that are living with dementia globally. So how does that impact on their health and well-being? How does it impact on their future in terms of their productivity and their contribution to society? So for me, it's been a really interesting to be part of this whole forum. I've learned a lot myself, and I also hope that we've brought some of those issues to the table for people to think about, policymakers and researchers that have been here for the last 2 days.
And that's a perfect segue to my next question, which is, the theme of sex and gender differences feels like it's niche but growing. Yeah. So how do we all become ambassadors to get that message out and to make sure that at future editions of this conference we have even more of the right people in the room?
Yeah. I think we just keep talking about it. We have to keep, it's a really good way to say it, that we're ambassadors. We have to keep bringing that conversation to the table. And that's a theme, I think, that has been coming up over and over again. We have to keep making sure that we have gender disaggregated data, that we encourage more women to take part in clinical trials, and that we're looking at precision medicine. And as researchers, that we're actually ensuring that we take some of those issues to the table when we're looking at the projects that we're working at, that we make sure that we include the voice of women in all of our research. That means women that are living with dementia, in my case, but they're carers as well. So we just keep that in our minds all the time, and we bring more men along with us. I think we've got a lot of enlightened men that are in with us for the last 2 days, but we just keep pushing and doing that in a very positive way, because I think, when we look at the health and well-being of women, we're going to make it better for everybody, aren't we?
That's true. That's very, very true. And so if you had to, I'm putting you on the spot a little bit, but if you had to think of a pitch to the incoming generation, the new policymakers, the new researchers, what's the pitch to really have them around the table on this?
Well, I think we have to start encouraging discussions very early on and educating both men and women that we have to bring young men and women together to make some of these decisions, to look at how we organize our research, how we look at medicine, but how we turn it into something that's tangible so that it actually has an impact on everyday lives. So for me, as somebody who works in policy, that we have to make sure that we push this through to governments so that we have regulatory and legislative views that are actually bringing in the needs of women as well. So we have to start when kids are really young. And I think there was a discussion this weekend about how we start when kids are young, that we start teaching them that it's both our responsibility. It's not just raising up women, it's raising up men and making sure that we're sharing a lot of that. So that's what I would do. I'd start with them at a very young age.
No, that's true. And that came up, actually. Somebody said that I think their son was reading, it was 5, was reading a children's book that was from 15 years ago. And there were some pretty ingrained stereotypes in there. So yeah, I think it has to be sort of from all sides.
I have a daughter that's going to university, and I was so encouraged that so many of the young, but when we went to look at science programs, there was a lot of young women that were in that, and I think this is great. We're entering a very important workforce, so it's good. I'm hopeful.
Good. Excellent.
Yeah.
Great. Well, thank you for being here with us.
Thank you. Thanks very much.